All right, so let's get started with what drugs can do. And I want to start with tobacco. People who use tobacco products like cigarettes or dip, they're exposed to multiple risks, not only from addiction to nicotine, but also from the health risks of smoking tobacco. And cigarette manufacturers add up to 600 chemicals to tobacco, which lead to cancer of the mouth, esophagus, and the pancreas. And when a person smokes, the toxic chemicals from the tobacco are inhaled along with like the tars and the carbon monoxide, and that leads to heart disease, lung cancer, and also emphysema. And tobacco actually decreases your stamina and it can stain your teeth, wrinkle the skin, and result in chronic halitosis, like bad breath. And even using e-cigarettes, one is still like people are still addicted to nicotine, or you're at risk of being addicted to nicotine. And while e-cigarettes actually do minimize the dangers from smoking, their use has been associated with heavier use of regular cigarettes in youth. And women who smoke while they're pregnant may have babies that are smaller and weigh less at birth. And these infants are at greater risk for dying of sudden infant death syndrome. Does anybody know what sudden infant death syndrome is? Yeah, crib death, yes. So they just stop breathing, and there's no particular reason. Males are particularly more susceptible to this, and children born in the winter are more susceptible to SIDS. But adults can actually die of SIDS too. We just call it asphyxiation. It's not. Yeah, you can't breathe. You stop breathing. Right. Yeah, the babies just they don't. What actually happens is they just their breathing cycle stops and they're asleep, and so they don't wake up to make themselves breathe again. They don't have that ability to do that. That's why it's so important to, huh? Right. So they're not able to do that. Hmm. All right. So moving into hallucinogens like marijuana, marijuana is a mild hallucinogen that causes short-term problems like impairment of coordination, concentration, and short-term memory. But the long-term use can lead to a lack of energy and amotivational syndrome, which is like a lack of motivation, and also impairment of your long-term memory. And these effects can linger even after you stop using the drug. Also, heavy use appears to produce approximately the same lung and cancer risk as smoking 5 times as much tobacco. So that's like for every joint that you smoke, it's like smoking 5 cigarettes as far as the cancer risk goes. And then also, like as with tobacco, lung damage and risk of cancer are significant hazards of continued marijuana use. And like I was saying earlier, adolescents who abuse the drug heavily during the ages of 14 to 24 are actually at an increased risk of developing schizophrenia. And then also pregnant women who use marijuana during the 14th through the 24th weeks of gestation, they also put their baby at risk of later developing schizophrenia. So, you can have hallucinations, increased saliva production, um, your lung, it's going to affect the ventilation and the bronchodilation. For your heart, acute dosage is going to, it could cause tachycardia, and chronic use can cause bradycardia. For the gastrointestinal, it can cause nausea, vomiting, and anorexia. And I can't say that word, antiemetic, and increased appetite. Um, and then it does have a role in treating those with chemotherapy who are going through chemotherapy for cancer. As far as like the nausea goes, it does affect our motor activity. It causes dryness of the eyes, redness of the eyes, dry mouth. Low doses is going to stimulate cough. High dose actually depresses the cough. It's going to increase the cardiac demand, and it can cause infertility and menstrual changes. It does decrease the motility and the amount of sperm that men do produce. And it can, for women, it can actually cause irregular cycles or like missed cycles. For synthetic marijuana, what they're selling at the gas stations, we call this Kush, K2, Spice, herbal incense. This is not just one specific drug. There's over 100 different chemicals or chemical structures with as many different names. And they all fit under this broad category of synthetic marijuana. And they also are going to vary in strength. The most frequent problems that people are experiencing are increased heart rate, increased blood pressure, vomiting, tremors, acute kidney injury that can actually result in kidney failure. And because this drug does fall under the category of a hallucinogen, it causes disorientation, paranoia, hallucinations, and psychosis. Those are also frequent negative effects that are experienced by users. Does anybody know what a synthetic dissociative anesthetic is? No? Okay. This is like PCP, ketamine. So PCP, also called angel dust or wet, ketamine, people call it special K. These also cause hallucinations and a loss of touch with reality. They can cause flashbacks. Both can result in impaired motor functioning and muscle rigidity. Like your muscles are stiff. You can't move. In that, if your muscles are rigid, you won't be able to move them. You'll be stuck in the position that you're in. And I've actually seen this happen. There was a guy, they pulled him out on a stretcher, and he was sitting on the back of the couch, and he had his arms up on the back of the couch, and they had put him on the stretcher, and he was still sitting with his arms in that same position because he couldn't move. His muscles were rigid. We have PCP and obviously higher doses of ketamine. They can cause dizziness, speech problems, nausea, vomiting. And then PCP at higher doses and ketamine at any dose can actually result in death. And then ketamine that's combined with alcohol or benzodiazepines can be especially lethal because it depresses the central nervous system. When I say depressed, I don't mean sad. What I mean is depressed means to reduce. So it's actually reducing our central nervous system, like our heart rate, our breathing, things like that are controlled with the central nervous system. And so if we have one depressant, which is the ketamine, and then we combine it with alcohol, which is another depressant, or benzodiazepines, which are anti-anxiety medications like Xanax and things like that. If we combine those together, it can be as lethal as taking too much heroin or opioids or fentanyl or things like that. You just kind of go to sleep and stop breathing. Then we have stimulants like cocaine or crack. No, Xanax is a benzodiazepine. Yeah, it's an anti-anxiety medication. All right, so with cocaine and crack, when we use cocaine, it can produce irritability, mood disturbances, restlessness, paranoia, auditory hallucinations like hearing things that aren't there. And cocaine has also been linked to many different types of heart disease. And it's been found to trigger chaotic heart rhythms, heart attacks, accelerate the heartbeat and the breathing, and it also increases the blood pressure and the body temperature. And so the physical symptoms that you're going to experience may include chest pain, nausea, blurred vision, fever, muscle spasms, convulsions, and also coma. And then in addition, the strokes, the seizures, and the headaches are common in heavy users. So we've got the nervous system, the heart's going to start beating faster, the blood pressure is going to rise, to ready the body to fight off the perceived threat that they think is, or that the body thinks is happening. And then we have like the musculoskeletal system. So the muscles are going to get tense, and then they can trigger tension headaches. The respiratory system, our breathing is going to quicken. In our cardiovascular system, our heart rate is going to increase. Our endocrine system, we're going to get signals sent from glands to the body that's going to cause a release of cortisol, which is the body's fight or flight system. And we're going to perceive what's going on as a threat is happening. So your body's going into fight or flight mode. And then the gastrointestinal system, eating habits are going to change. You might feel butterflies in your stomach. You're not going to feel as hungry, because when the body goes into fight or flight, it kind of takes the blood away from the non-essential organs, and the stomach is one of them. So the digestive system is actually going to slow down when you're in fight or flight, and you're not going to want to eat when you're in fight or flight mode. And so when we're using cocaine or crack, that's what's actually happening. And then if you're regularly snorting cocaine, it leads to a loss of sense of smell, which is called anosmia, which is what happened to a lot of people when they got COVID. They couldn't smell anything, they couldn't taste anything. And some people have actually committed suicide because you just kind of lose all joy in life if you can't taste or smell things. And you put yourself at risk of accidentally killing yourself because you can't smell smoke, you can't smell rotten meat, you can't smell rotten milk, things like that. You're not able to smell it or taste it. So you're putting yourself in danger if you lose your sense of smell or taste. People who snort cocaine also have nosebleeds, problems with swallowing, hoarseness, like the nasal drip can cause like a hoarse voice, a raspy voice, and then just like an overall irritation of that nasal septum, which can lead to a chronically inflamed runny nose, and that would be really annoying. And longer periods of snorting actually do cut off the blood flow in the nostrils, and they cause the membranes to die, and that can result in a hole in the septum. And that hole typically doesn't heal on its own, but sometimes it can be repaired. And the worst case scenario is a collapse of the entire nose. So if you've ever seen anybody who's had their nose collapse, it's not a pretty sight, I'll tell you that. And then, when we ingest cocaine, it can actually cause gangrene, which is the death of soft tissue in the intestines, because of the reduced blood flow in the digestive tract. And people who are injecting cocaine can also experience allergic reactions, either to the drug or to an additive that they put in there, which can also result in death. And because cocaine often causes reduced food intake, a lot of chronic cocaine users are going to lose weight, and they're going to lose their appetite, and because they're losing their appetite, they're experiencing that significant weight loss, and also malnourishment, which is going to affect other organs in the body. And so you could eventually have organ failure because you're malnourished. Then we have methamphetamines, and this can cause a lot of cardiovascular problems, heart problems. And that's going to include rapid heart rate, irregular heartbeat, increased blood pressure, and irreversible stroke-producing damage to the small blood vessels in the brain. So if you don't know what a stroke is, it's when a blood clot actually travels from somewhere in the body into the brain. And as the blood vessels are going up into the brain, the blood vessels are actually getting smaller the closer to the top of the brain. And so this blood clot will get stuck somewhere and block the flow of blood to that area of the brain. And if we have no blood flow, then we have no oxygen, and the brain cells in that particular area start to die, and then we lose the ability to function in that sector of the brain. So for some people, that could be sight, it could be any one of the senses, it could be our emotional regulation, it could be our thought processes, it could be speech. Any number of things can happen depending on where the blood clot is in the brain and how quickly they can dissipate that blood clot. And that is not reversible. Like, that damage that's done in a stroke is done. um, actually, the person that I was talking about a couple of weeks ago that I had to go to his funeral last week, he passed away. He had a stroke and nobody found him for 5 hours. And he was still alive, but he was complete vegetable. Like he had no brain function whatsoever because nobody had found him for 5 hours. And then with chronic methamphetamine use, it also results in an inflammation in the heart lining. And among users who shoot up, they could have damaged blood vessels and skin abscesses. Psychotic symptoms sometimes persist for even months or years after the use has ceased. So even after you stop, you can still continue to have those symptoms. And then the research is indicating that meth use during pregnancy can result in prenatal complications like increased rates of premature delivery, which increases the risk of SIDS, and other issues later on for the children like ADHD and things like that. And then also altered behavioral patterns in the infant like abnormal reflexes and extreme irritability. And there is an uptick in for both marijuana use and methamphetamine use, there's an uptick in those children actually later being diagnosed with ADHD. Then we have designer drugs. These are synthetic stimulants like MDMA, which is Molly or ecstasy. And then also falling under this category is bath salts or cathinones. It's a synthetic form of the chemical that's found in the cat plant and a couple of other that fall under the designer drug category. But bath salts are a combination of these two really powerful stimulants that instead of just wearing off after a couple of hours, they actually continue to produce full effects for days or even weeks. I'm sorry, but I got stuff to do. Like, I don't have time to be high for weeks. It's going to cause agitations, increase in body temperature, excessive sweating, increased heart rate, blood pressure. All of these are possible side effects. Seizures are common. And a lot of people experience hallucinations and paranoia. They tear their clothes off. They try to tear off parts of their body. Suicides have occurred. I don't know if y'all remember that guy that tried to eat that other guy's face on the bridge in Florida. Do y'all remember that? No? Yeah. Yeah. Abs- yeah. So that was actually that guy was on bath salts. But with like ecstasy, people use this as like a club drug, right? And so a lot of these clubs have gotten these like rooms where it's like cool down rooms or calm down rooms. So you can like go because you're gonna get dehydrated. And you're out there, you're just dancing or whatever, and you're gonna get hot. You're not gonna drink anything. You're gonna get dehydrated, and you can die from dehydration. So they have these rooms where they'll like give you water and let you calm down because your body temperature actually increases. And if your body temperature increases, you can have a febrile seizure, which is a seizure because you're too hot, and you could die. So club owners have gotten sick of people dying in their club because people are dehydrated and having febrile seizures. So they have these rooms in there for some of these clubs. Um, Bath salts, like, well, kind of like with the bath salts, the MDMA, the adverse effect can last for a week or more after using the drug. And depression is common after using it. So, yeah, you're going to have a good time, but you're going to be depressed for the next week, which sucks. And then when we take it in higher amounts, MDMA actually produces anxiety, muscle cramping, and nausea. And my back already hurts, and I'm already filled with anxiety. Like, yeah, I don't need that crap on top of what I already have. And then you're nauseous too. Like, no, thank you. And that drug can actually result in a large increase in body temperature and high blood pressure, as well as kidney and heart failure. So your kidney can shut down, your heart can just stop. And death can occur, usually from a heat stroke or dehydration. Um, Now, moving on to opiates like heroin. Opioids actually do lower your heart rate and they slow down your breathing, and they also decrease your blood pressure because they are depressants. And chronic heroin abuse can actually result in scarred or collapsed veins, bacterial infections of the blood vessels, and also in the heart valves, abscesses or boils, and other soft tissue infections, and also liver and kidney disease. And then we have lung complications, including various types of pneumonia and tuberculosis, can result from the poor health condition of the abuser, as well as the heroin's depressing effects on the respiration. Now, who created heroin? Does anybody know? A doctor. It does come from poppy seeds, you're right. But who actually isolated heroin? Promethazine is an anti-nausea medication. I don't think it's an opioid. Codeine actually falls under that. So if you're thinking about lean, where they mix codeine and promethazine, the promethazine is to keep you from vomiting. It's to keep the codeine down so that it gets you more high, because the body's natural response to having too much of something like alcohol or a medication or something is, once it realizes that it's too much or it's toxic, the body's natural response is to vomit to get the rest of it out of your stomach, because it doesn't want to keep digesting that. So the promethazine is actually there to get rid of the body's response to vomit and keep the codeine in your system to get you more high, which is dangerous, by the way. Huh? Who is they? Uh, is promethazine an opioid? Promethazine can be an opioid when it's combined with other drugs such as codeine. But promethazine itself is actually prescribed to pregnant women when they are having nausea in their first trimester. It's not in and of itself an opioid. But when you combine it with it could be combined with an opioid to stop the vomiting. Yeah, that's what I was just saying. That they're actually putting the promethazine in there to stop you from vomiting so that you can get more high on the codeine. Because the body's natural response is to vomit when you have too much of something in the stomach that it realizes is a toxin. Yes, it will. 100%. Um, And so the person who, or the company that actually isolated heroin was Bayer, the same company that produces aspirin. And they created the heroin as a medication. It was sold as a medication for quite some time uh, to treat the cough as a cough suppressant for tuberculosis, which is ironic because the health conditions, like the poor conditions that heroin abusers put themselves in, actually lead to tuberculosis. Interesting, right? And also, like, sharing needles can lead to some of the most severe consequences of heroin abuse, like infections with hepatitis B and hepatitis C, HIV, and other bloodborne viruses. And then drug users can then pass that on to their sexual partners and their children and things like that. So, mhm, absolutely. So when we're talking about opioids and opiates, the other opiates, these are prescription drugs like fentanyl, codeine, which is like cough syrup, Vicodin, Loratab. Then you have like methadone or oxycodone, which is Oxycontin and Percocet. And these are all going to affect the body by slowing down the central nervous system. And that's what regulates our breathing and our heart rate. So if we take these alone, or if we take them in conjunction with alcohol or benzodiazepines, then that actually results in an overdose, since all of those substances are depressants. And so signs of overdose are going to include shallow breathing, cold skin, blue lips or fingertips, and a loss of consciousness. And then it also causes nausea, vomiting, and constipation. One thing that actually is an opioid that most people don't know is an opioid is Imodium. And we can buy Imodium over the counter. It doesn't cross the blood-brain barrier, though, so it doesn't get you high, but it is actually an opioid. And it's what you take if you are having diarrhea. It will stop the diarrhea, because that's what opioids do. They constipate you. So fentanyl does have like the ability to make you overdose just by touching it. You don't actually have to consume it. It actually does seep through the skin, and it can cause overdose death, or just overdose period, just by touching it. I had a young lady that came in, and she said she had gone over to these people's houses, and apparently she didn't know it at the time, but they had been preparing fentanyl or cutting something with fentanyl, probably methamphetamine, but they were cutting something with fentanyl. And she had come to the house, and she put her hands down on the table, and she was just sitting there talking to them. And she said, I just started feeling really tired. And so I asked him if I could go lay down. And so he said I could go into the back room. And somebody came in to check on me and realized that I was overdosing. And she hadn't even used it. She just put her hands down where it had been prepared. So this is serious. Like, they're putting it in marijuana, they're putting it in meth, they're putting it in coke, they're putting it in all types of things. So nothing is safe. Nothing. There was a young boy, he was 18 years old. This was a family friend. His younger brother was 18. He died of a fentanyl overdose because he was sharing a blunt with somebody, and they had laced the blunt with fentanyl, and he died just because he wanted to get high on weed. So let's move on. Depressants and sedatives. So these prescription drugs are primarily benzodiazepines like Xanax, Klonopin, Ativan, Valium, and also the barbiturates. So we used to prescribe barbiturates a lot, but they have like a narrower window of like benefit, right? So like if you take 2 or 3 of these, you could possibly die. Their therapeutic window is very narrow. But with the benzodiazepines, it has a wider therapeutic window. So you can take a little bit more than that. Like, if you took one and then you forgot that you took it, taking another one isn't going to kill you. But it can kill you if you overdose on benzodiazepines, because it is a central nervous system depressant. And so the short-term effects of benzodiazepines or any of the depressant sedatives, barbiturates or benzos, include impaired vision, motor coordination, and speech, as well as like confusion and impaired thinking. And then your breathing can become depressed, and it might result in a coma or death, especially when those drugs are combined with alcohol. I know a lot of people combine alcohol with Xanax, and that is a very dangerous situation. It's not like a 1 + 1 = 2 situation. Like, 1 Xanax equals 1 beer. That is not what it is. So it would be like saying 1 beer times 16, because it's like taking 16, 20 drinks if you're combining 1 beer and 1 Xanax. It's what we call a synergistic effect. It multiply exponentially. So have you known anybody who has had any physical problems that sound similar to those listed? And if you have, feel free to put that in the comment section below this video.